We've been using SNOMED CT since 2013. SNOMED CT was a relatively easy choice. It came with fairly good recommendations from other users. It also had an emergency department reference set, which was particularly appealing. And as a result of that, we were able to get our hands on that ref set and have a good look at it prior to implementing. And that had certain advantages. We could see straight away that the terms that were covered off were in fact very appropriate for use in our emergency department, and it was a natural fit with the types of patients and the diagnoses that we were making.
SNOMED allows me to use my clinical judgment as freely as I had before it existed. It's a coding system that sits in the background.
So we're capturing every single diagnosis that is made from our patient population entering the emergency departments, and that's all 100% SNOMED coded.
We've been finding using SNOMED through ED at a glance very useful for us. It's a lot more precise than probably what we used to do before, which was using a whiteboard system and waiting for the pre-printed charts to come out. So by able to have those fields populated by SNOMED and having the correct terminology there, it's been big advances for the department, I think. Often you just need to type in 3 or 4 letters and then it will come up with a list.
SNOMED is far more precise, and so we often have problems translating our diagnosis into an acceptable read code that can capture that accurately.
Read is no longer supported. So the main problem with READ is that we no longer have codes that we need for modern medicine. So coronary angioplasty with a stent is not included in READ.
I've got nothing but a high recommendation for swapping over to SNOMED. In terms of the ability to find the diagnosis that you're looking for, SNOMED I think is unparalleled. It is very, very easy to choose the appropriate term. It gets away from using woolly terms that really don't describe what you're seeing, and we've found it to be universally excellent.
Overall very positive. Nobody seems to have negative experiences with it. It's a seamless system.
So it's about a partnership and an evolution, and I think it's a really exciting time. I think there'll be huge power for the clinicians and they'll get a lot of benefit from using it.